I was once young. And as I grew older, my memories started to become hazy. And that's when I knew I had Alzheimer's disease. Presented by Alyssa Martin, Coral McKinney, Anthony Prasad, and Christina Torres. Biology 100, Group Project number 28. Professor Jenna Trench, we present to you our Alzheimer's disease project.
Hey, Professor Trench, I will first go over the stages of Alzheimer's disease. Alright, so let's get started. First up is preclinical Alzheimer's disease. In this stage, there are changes happening in the brain, but no symptoms are visible yet. This phase can go on for years while the brain undergoes these changes, but it won't impact daily life. Then we move to mild cognitive impairment. This is where subtle memory changes might start showing up, but they're not yet affecting daily activities. For example, someone might start forgetting recent plans, the names of people they've just met, or details from recent conversations. They may feel a bit disoriented about time or place, and even express that something doesn't feel quite right, almost like a foggy feeling in their brain. This stage can last several years. Next, we reach mild Alzheimer's disease, or the early stage. This is usually when Alzheimer's gets diagnosed. People may notice mild forgetfulness, which becomes noticeable to the patient, family, and friends. Short-term memory challenges increase, like misplacing objects often, struggling to remember new information, or facing difficulties at work. They may also start to repeat themselves or forget words mid-sentence. Some mental health changes may show up too, like depression, confusion, or sleep problems. Despite these changes, they can still live independently. This is also a good time to start planning for the future, maybe discussing topics like end-of-life care and involving family members in decisions. Typically, this stage lasts a couple of years. Now let's talk about moderate Alzheimer's disease, the middle stage. This is where things really start to shift. Confusion becomes a bigger issue, affecting the person's ability to function, and they'll start to need more help. Safety is a primary concern in this stage because they may wander or forget how to do daily tasks like cooking or dressing appropriately. Sleep issues, mood swings, and even hallucinations can also start showing up. During this stage, there's something called sundowning, where confusion and agitation increase in the evening. This period is intense for caregivers since the person requires continuous supervision and support. Moderate Alzheimer's is generally the longest stage. Lastly, we have severe Alzheimer's disease, or the late stage. Here, symptoms are extremely severe, and the person may lose the ability to communicate or even move around much. They'll likely spend most of their time sitting or lying down. Motor skills decline further, and issues like swallowing difficulties put them at risk for lung infections, such as pneumonia. A speech-language pathologist might assess if they need a feeding tube or if their food needs to be prepared differently for safety. Even though communication is limited at this stage, interacting with them is still important. Things like facial expressions, gentle touch, and creating a calming environment with soothing music can make a difference in their quality of life. So these are the stages of Alzheimer's disease. I hope this breakdown helps you understand the progression a bit better. Alright, let's talk about Alzheimer's disease and the most common form of dementia. Dementia itself is a broad term describing a decline in brain function that interferes with daily life, and Alzheimer's affects core abilities like memory, thinking, and behavior. You might also hear it called a major neurocognitive disorder. Causes. The exact cause of Alzheimer's isn't fully known, but research shows there are certain changes in the brain tied to the disease. These changes lead to the formation of structures called neuritic plaques and neurofibrillary tangles. While most experts agree that these structures are involved, we still don't know why they occur in some people and not others. There are some risk factors that make Alzheimer's more likely though. Age is the biggest one, though Alzheimer's isn't a normal part of aging. Having close relatives with Alzheimer's, like a parent or sibling, can also increase the risk. Other factors include specific genes, being female, having cardiovascular issues, high cholesterol, and a history of head trauma. Types of Alzheimer's disease. There are two main types of Alzheimer's disease: early onset and late onset. Early onset usually shows up before age 60 and progresses more rapidly. It's less common but often runs in families with some specific genes tied to it. Then there's late onset Alzheimer's, the most common type, typically affecting people over 60. This form may also run in families, though the role of genetics is less clear. Symptoms. The symptoms of Alzheimer's vary and progress over time. People often experience a stage called mild cognitive impairment, or MCI, before Alzheimer's develops. MCI involves mild memory or thinking issues that don't yet interfere with daily life. People with MCI may forget recent events or familiar names and might take longer with mental tasks. Not everyone with MCI progresses to Alzheimer's, though. Early symptoms of Alzheimer's include difficulties with tasks that involve some thought, like balancing a checkbook, learning new routines, or playing complex games. People may get lost on familiar routes, have trouble naming common objects, or lose interest in things they once enjoyed. Family and friends might notice subtle personality changes, forgetfulness, or mood swings. As the disease advances, symptoms become more noticeable. There may be confusion, difficulty with daily tasks like dressing, cooking, or driving, and trouble recalling recent events. Mental challenges deepen, leading to issues like poor judgment, a loss of social skills, and sometimes violent behavior. Some people with Alzheimer's also experience mood changes, delusions, or even hallucinations. It's also common for sleep patterns to change, leading to restlessness and waking up often at night. In the late stages, symptoms become severe. Patients may lose the ability to recognize family members, communicate, or perform daily activities, like eating and bathing, on their own. Communication becomes minimal, and there may be issues with motor skills. Problems with swallowing can also lead to a high risk of lung infections like pneumonia. Diagnosis. Diagnosing Alzheimer's requires ruling out other causes of dementia, like stroke, brain tumors, or chronic infections. Healthcare providers typically perform a full physical and neurological exam, ask about the patient's medical history, and use mental function tests. In some cases, they may also do a CT or MRI scan to check for other possible causes of symptoms. The only way to confirm Alzheimer's with complete certainty, however, is by examining brain tissue after death. Treatment. Currently, there's no cure for Alzheimer's. Treatment focuses on slowing the disease's progression and managing symptoms. Medications may slightly slow down memory loss or help control behavioral symptoms, but their effectiveness varies. Adjusting the home environment to make daily life safer and easier for the patient can also make a big difference, and supporting caregivers and family members is crucial as the disease progresses. Support for families and caregivers. Living with Alzheimer's or caring for someone with it is challenging, and the disease's progression can vary. Some people decline quickly, while others may live many years after their diagnosis. Connecting with support groups can help caregivers and family members share their experiences, get advice, and feel less alone. Outlook. On average, people with Alzheimer's live 3 to 20 years after diagnosis and the disease's final phase can last from a few months to several years. During this period, patients typically require full-time care, and many pass away due to infections or organ failure. Planning ahead is essential for families to prepare for future needs. Prevention. There's no known way to fully prevent Alzheimer's, but certain lifestyle choices may help reduce the risk or delay its onset. A diet rich in omega-3 fatty acids and low in fat regular physical exercise and staying socially and mentally active may help. It's also important to protect your brain from injuries by wearing helmets during activities that pose a risk for head trauma. And here are some alternative names for Alzheimer's disease that you might come across. It's also known as senile dementia of the Alzheimer type, or SDAT for short. Other terms include dementia, Alzheimer type, and simply Alzheimer's dementia. You may also hear it referred to more generally as a form of senile dementia, which is dementia occurring in older age, though Alzheimer's itself is a specific disease with unique characteristics.
So, what is plaque? Here is a video explaining what it is.
Plaque is an abnormal cluster of protein fragments. Such clusters can be found between nerve cells in the brain of someone with Alzheimer's. A microscope will also show damaged nerve cells. In them are tangles, called neurofibrillary tangles. These consist of twisted strands of a different protein. Together, the plaque and tangles cause structural and chemical problems. It appears that Alzheimer's disease causes parts of the brain that normally work together to disconnect.
Dementia isn't technically a disease, but more of a way to describe a set of symptoms like poor memory and difficulty learning new information, which can make it really hard to function independently. Usually dementia is caused by some sort of damage to the cells in the brain, which can be from a variety of diseases. Alzheimer's disease, now referred to as Alzheimer's disease, is the most common cause of dementia. Alzheimer's disease is considered a neurodegenerative disease, meaning it causes the degeneration or loss of neurons in the brain, particularly in the cortex. This, as you might expect, leads to the symptoms characteristic of dementia. Although the cause of Alzheimer's disease isn't completely understood, two major players that are often cited in its progression are plaques and tangles. Alright, so here we've got the cell membrane of a neuron in the brain. In the membrane, you've got this molecule called amyloid precursor protein, or APP. One end of this guy's in the cell, and the other end's outside the cell. It's thought that this guy helps the neuron grow and repair itself after an injury. Since APP is a protein, just like other proteins, it gets used and over time it gets broken down and recycled. Normally it gets chopped up by an enzyme called alpha secretase and its buddy gamma secretase. This chopped up peptide is soluble and goes away, and everything's all good. If another enzyme, beta secretase, teams up with gamma secretase, then we've got a problem, and this leftover fragment isn't soluble and creates a monomer called amyloid beta. These monomers tend to be more chemically sticky and bond together just outside the neurons and form what are called beta amyloid plaques. These clumps of lots of these monomers, these plaques can potentially get between the neurons, which can get in the way of neuron to neuron signaling. If brain cells can't signal and relay information, then brain functions like memory can be seriously impaired. It's also thought that these plaques can start up an immune response and cause inflammation, which might damage surrounding neurons. Amyloid plaque can also deposit around blood vessels in the brain, called amyloid angiopathy, which weakens the walls of the blood vessels and increases the risk of hemorrhage or rupture and blood loss. Here's an image of amyloid plaque on histology. These clumps are buildups of beta amyloid, and this is happening outside the cell. Another big part of Alzheimer's disease are tangles, and these are actually found inside the cell, as opposed to the beta amyloid plaques. Just like other cells, neurons are held together by their cytoskeleton, which is partly made up of microtubules. These track-like structures essentially act like a minecart shipping nutrients and molecules along the length of the cell. A special protein called tau makes sure these tracks don't break apart, kind of like railway ties. Although, again, not completely understood, it's thought that the beta amyloid plaque buildup initiates pathways inside the neuron that leads to activation of kinase, an enzyme that transfers phosphate groups to the tau protein. The tau protein then changes shape, stops supporting the microtubules, and clumps up with other tau proteins, or gets tangled, and leads to the other characteristic finding of Alzheimer's disease, neurofibrillary tangles. Neurons with tangles and non-functioning microtubules can't signal as well, and sometimes end up undergoing apoptosis or programmed cell death. Here's an image of histology showing these neurofibrillary tangles formed inside the cell. As neurons die, large-scale changes start to take place in the brain. For one, the brain atrophies or shrinks, and the gyri get narrower, which are the characteristic ridges of the brain. As those get narrower, the sulci, which are the grooves between the gyri, get wider. With atrophy, the ventricles, fluid-filled cavities in the brain, get larger. So that's the pathophysiology part. But why does this happen in some people and not others? Well, Alzheimer's disease can be split into two groups, sporadic and familial. Sporadic's used to describe the late onset type, where the exact cause isn't very well defined, and is probably a combination of genetic and environmental risk factors. Sporadic accounts for the vast majority of cases. With sporadic Alzheimer's, the risk increases significantly with age, affecting around 1% of people age 60 to 65 and 50% of people over age 85. In fact, a gene that's been identified as possibly contributing to an increased risk of Alzheimer's disease is the E4 allele of apolipoprotein E gene, or APOE4. Researchers have shown that the risk of developing Alzheimer's disease increases for patients that inherit one E4 allele and increases even more for patients who inherited two E4 alleles, one from each parent. Apolipoprotein E helps break down beta amyloid, but the E4 allele seems to be less effective than other alleles like the APOE E2 allele, meaning patients are more likely to develop beta amyloid plaques. Familial Alzheimer's disease is used to describe cases where some dominant gene was inherited that speeds up the progression of the disease. So sometimes familial Alzheimer's disease is referred to as early onset Alzheimer's. Familial accounts for between 5 and 10% of cases and can be caused by several gene mutations. First, mutations in the PSN1 or PSN2 genes on chromosome 14 or chromosome 1, respectively, have been linked to early onset Alzheimer's. These genes encode for presenilin 1 or presenilin 2, both protein subunits of gamma secretase. Mutations in these SEN1 or SEN2 genes can change the location where gamma secretase chops APP, producing different length beta amyloid molecules, which seem to be better at clumping up and forming plaques. Another known genetic cause of Alzheimer's is trisomy 21, or Down syndrome, which involves an extra copy of chromosome 21. It turns out that the gene responsible for producing APP is located on chromosome 21, which means that people with Down syndrome have an extra APP gene, and so presumably increased expression of APP and possibly increased amounts of amyloid plaque. For this reason, familial Alzheimer's disease often progresses by age 40. Symptoms of Alzheimer's disease worsen as plaques and tangles build up and neuronal damage accumulates. In the early stages, symptoms may not even be detectable. As it progresses, patients lose short-term memory, like for example, they may not be able to remember what they had for breakfast that morning. They then progress to loss of motor skills, making things like eating difficult without help. Also, language becomes affected, making it more difficult to communicate. Eventually, they lose long-term memory, like forgetting the name of their spouse or even that they're married, and progressively become more disoriented, which can be dangerous because they might wander from home and get lost. In late stage, they become bedridden, and the most common cause of death is actually infection, like pneumonia. Diagnosis of Alzheimer's disease is really tough because the only way to definitively show that a person had Alzheimer's is by performing a brain biopsy after autopsy. Usually, a clinician will therefore make a diagnosis after excluding other causes of dementia. Currently, there isn't any cure for Alzheimer's disease. Some medications exist, but the benefits are small, and there haven't been any medications that clearly and definitively halt the progression of Alzheimer's.
Alert! Breaking news!
HealthCast, a pre-clinical trial involving Alzheimer's research is underway right here in South Florida, as well as sites across the country. Participants are being recruited for the study. It will actually use a blood test that can detect a biomarker for Alzheimer's years before the disease is even diagnosed.
An ideal candidate would be someone who has a family member who suffered from Alzheimer's, whether it be a parent, a sibling, that has that history, but is healthy, hasn't shown any signs of any cognitive issues.
And then those who test positive for that biomarker have the option to take part in a double-blind study looking at a medication that could slow, maybe even prevent the onset of Alzheimer's symptoms. To learn more about participating in this study, you can look for the story in the health section of local10.com. And studies have also shown that women are at a greater risk for Alzheimer's disease. And while researchers continue to investigate the reasons why that's so, experts say women really need to know what to be on the lookout for.
Women face a lot of common brain issues, but particularly as we age, we go through some things that can really look like a memory problem and create a memory problem. So one of those is just having a lot of stress.
So that's Dr. Jessica Caldwell with the Cleveland Clinic, and she says stress, along with other effects of menopause, can impact sleep and memory, leading to a sense of confusion and forgetfulness. The doctor says it's just really important to note how often it happens to you and how severe it is. For example, if you're forgetting the name of someone close to you, that really is a sign you need to be evaluated by a doctor.
Alzheimer's disease affects millions of Americans, but the impact varies significantly across different communities. Let's uncover some of the key disparities and unique challenges faced by these groups. Nearly 2/3 of Americans living with Alzheimer's are women. Of the 7 million people aged 65 and older diagnosed with Alzheimer's in the United States, almost 4 million are women. Older Black and Hispanic Americans are more likely than older white Americans to develop Alzheimer's or other dementias. However, disparities extend beyond prevalence. Half of Black Americans report experiencing healthcare discrimination, while at least 1/3 of Native American, Asian American, and Hispanic American populations have faced similar challenges. This discrimination creates barriers to receiving Alzheimer's care. More than 1/3 of Black Americans and nearly 1/5 of Hispanic and Asian Americans believe that discrimination would hinder their access to Alzheimer's care. These barriers highlight the urgent need for equitable healthcare practices. The LGBTQ+ community faces additional challenges. 40% of LGBTQ+ individuals report shrinking support networks as they age. Many fear discrimination, delaying their access to Alzheimer's care, and 40% say their healthcare providers are unaware of their sexual orientation. LGBTQ+ older adults are twice as likely to remain single, twice as likely to live alone, and 3.4 times less likely to have children to support them. These disparities increase the risk of isolation and complicate care needs. People with Down syndrome also face a higher risk of developing Alzheimer's disease. This is linked to an extra copy of chromosome 21, which carries a gene that produces amyloid precursor protein, or APP. Excess APP leads to a buildup of beta amyloid plaques in the brain, a hallmark of Alzheimer's disease. More than 90% of people with Down syndrome will develop dementia during their lives. Most individuals with Down syndrome show Alzheimer's disease brain pathology by age 40, and the majority develop dementia by age 60. By understanding these disparities, we can work toward breaking barriers and improving Alzheimer's care for everyone. Together, we can build a more inclusive and equitable future for those living with dementia.
Telling a therapist a story that don't make sense with a previous therapist, hey, y'all stay tuned.
Contacts are alphabet letters and animals. So is there anyone at home that I can speak with? You mentioned your uncle who's related to turtles.
I mean, my favorite letter is weasels, and yes, anybody at home, because, you know, my house is homeless. But wait, aren't you related to like grass meat or something?
Honestly, I think you could be suffering from early onset dementia.
Wait, I mean, I am one-dimensional. You being nosy with your needle, ain't you?
Did you hear what I said? I know last time we were having some trouble with the audio. So
Wait,
are you hearing me okay?
Wait, you yelling? Can you speak up, or you can speak lower? Neither work.
Okay. Can you hear me, Earl?
Bueno nachos.
After reviewing your sessions with my colleagues, I think we may need to seek some help from other providers.
I mean, my meatless dog provide for me. He at the dentist, you know, fixing feet left now.
And I need you to go inpatient at the hospital so we can monitor your symptoms more closely.
Jesus already doing that for me.
Oh, well, we are a faith-based practice. Would you like to pray with me?
I mean, no, we can. My fatherly fish who had floaties and drowned. I hope you still here with us today.
Okay, hey. Oh,
and
I think we're good. Amen.
Wait, hold.
Many misconceptions surround Alzheimer's disease and dementia. Let's clarify some of the most common myths about these conditions. First, Alzheimer's and dementia are not synonymous. Alzheimer's is one specific type of dementia. Dementia itself is a broader term that refers to conditions of the brain that decrease cognitive function. Another myth is that you can only develop Alzheimer's when you are old. While age is a significant risk factor, some individuals may experience symptoms as early as their 30s. For people with Down syndrome, symptoms often begin to appear in their 40s. It's also widely believed that there's no way to reduce the risk of developing Alzheimer's. In reality, certain risk factors can be managed to lower the chances. Maintaining good blood pressure, a healthy weight, staying mentally and physically active, and getting at least 7 hours of sleep each night are all ways to help reduce your risk. A common myth is that there's no treatment for this disease. While there is no cure to reverse Alzheimer's, there are medications available that can slow the progression of symptoms and improve quality of life. Finally, memory loss is often considered a normal part of aging, leading some to believe Alzheimer's symptoms are just an extension of this process. However, the symptoms of Alzheimer's are much more severe. In advanced stages, individuals may lose awareness of their surroundings, experience a loss of appetite, have difficulty communicating, and even suffer seizures. Understanding the truth about Alzheimer's is key to early detection, effective care, and reducing stigma around this disease.
Woke up this morning feeling hazy, trying to recall the days before. Faces blend into a world so crazy, but I can't trace them anymore. Pictures on the wall tell a story, but I'm lost in the scenes they hold. Memory, where'd you hide that glory? In the maze my thoughts are cold. I've got Alzheimer's in my mind's parade. Forget the path where memories fade, dancing through a foggy masquerade in a world that time has swayed. Dreams escape like whispers in the breeze. Every day a stranger in my home, fumbling through a maze without keys in a world that time has swayed. I've got Alzheimer's in my mind's parade. Forget the path where memories fade, dancing through a foggy masquerade in a world that time has swayed. I've got Alzheimer's in my mind's parade. Forget the path where memories fade, dancing through a foggy masquerade in a world that time has swayed.